بسم الله الرحمن الرحيم وصلى وسلم على أشرف خلق الله محمد بن عبد الله وعلى آله وصحبه وسلم. Welcome everyone in this session. Today, inshallah, we are going to discuss the respiratory system imaging, radiology of respiratory system. As you know from the previous block, the modalities that use in any an assessment or diagnosis of the certain system abnormality concerning the respiratory systems. The most common modalities that utilize an assessment and evaluation of the chest disease include plain X-ray or plain radiograph, computerized or computed tomography, CT, magnetic resonance imaging, MRI, ultrasound, nuclear medicine, and angiography. Those are called modalities, and we are going to discuss these modalities. Also, as you know, plain X-ray or plain radiograph or X-ray or conventional X-ray is the most important imaging technique that done for assessment of the chest abnormality. Radiographic interpretation or reporting require knowledge of normal anatomy and the technique and the variants that may simulate disease. So you have to discuss and to know the technique, different technique, the normal anatomy in each of these technique, and to know some anatomical variants that may mimic disease. Start with the technique. How this plain chest X-ray done? Chest X-ray done routinely on posterior view. What is posterior? If you look at this patient, she is erect in upright position. This is the film or detector is located here. The X-ray beam or X-ray photon comes from posterior and enters the back of the patient and exits anteriorly and then reaches the film, which is located anterior to the patient. So when the X-ray photon traversing the patient from posterior to the anterior, this is called posterior anterior view. Routinely chest X-ray done on PA view, not AB view. Also there is another optional view that sometimes may be requested. Lateral view. Lateral view, the X-ray photon or X-ray beam enter from the side of the patient and exit from the other side and then reaching the detector or film to form the image. So we have two projection, PA, and this is a routine, and the lateral film is an optional view which is done for more characterization of the lesion if there. So chest X-ray should be done on PA view, and also the patient should take full inspiration. The technique asks the patient to take full inspiration, to enter the air in, and the patient should be on upright position. So why is this chest X-ray done on PA and full expiration and erect? Film done or X-ray done on full inspiration because in this full inspiration the base of the lung will be clear, not hazy. When the chest X-ray done on expiration phase, the base, this is called base of the lung. The base of the lung becomes more hazy. So chest X-rays will be done in full inspiration. يعني دائما التكنيشن asks the patient to take air and then stop the breathing. And then the technician exposes the patient to do this X-ray. Why done on full inspiration? To avoid haziness of the base of the lung. But this is the result good technique chest X-ray, which is done in PA and erect position and in full inspiration. In this technique, the chest X-ray done on AB and supine. The patient is supine, and the X-ray, this is a tube called tube. This is the source of X-ray. The X-ray produces this part, and then X-ray move and interferes into the anterior part and exit from the posterior and then reaches the film. So this is AB view. The patient supine and the X-ray enter anteriorly and exit from the posterior. And this is the result, and this is the film on this when the patient in supine and AB. And you can see this film of bad quality compared to the AB to the BA film. Why? Because you can see the heart is magnified. So this is the first problem of the AB film. The heart apparently enlarged, and also the mediastinum, and also you can see the diaphragm is higher. يعني البيشنت لما يكون supine difficult to take the full inspiration. لذلك the lung is not inflated with air, so the diaphragm may be higher. So this chest X-ray should be done PA, erect and full inspiration. And also in erect position, the gravity push the diaphragm down, but on the supine film, the diaphragm also be raised because we cancel the effect of the gravity, which play a very important role in erect position. So this chest X-ray should be done in BA. On lateral film.
دكتور اسمع. معلش على المقاطعة، بس في طالبات يقولون ما يقدرون يدخلون.
طيب اوكي. انا رسلت الرابط من بدري عشان لما جاي. The lateral view is an optional, not routinely done. It is done if there is, for example, lesion that not well characterized on PA, for localization of the lesion to know where this lesion, in which lobe, and so on. So it is an optional view. It demonstrates the third dimension because the frontal view is 2-dimension. To add the third dimension, usually we do this PA lateral view. On lateral view, the left side should be against the film, and the right side should be against the tube or the source of X-ray radiation. Why? Also to avoid magnification of the heart. There is a rule in radiology. If the organ or object is more close to the film, the shadow of this object on the film should be equal to the image part. لذلك إنه the heart is located in the left side. So lateral film usually done on left side on contact or more close to the film. On the right side, close to the X-ray tube, towards the X-ray tube. ليش? To avoid also magnification of the heart. So this also lateral view should be done with lateral side against the film. So this is a lateral view of the chest X-ray. You have to look to the shadow of the vertebra. If you look carefully, there is increase of blackness when we go down in this vertebra. لاحظ ان these are the vertebra, cervical, thoracic vertebra. There is increase of blackness when we go down. If you compare this vertebra with this one is more blackened than the superior one. So there is increase of blackness of the vertebra when we go down on the lateral film. This is most important normal appearance of the vertebra on lateral film, because if there is a pathology, this feature may be changed. So you have to know the normal appearance of the vertebra on the lateral view of the chest. طيب تكلمنا عن posterior, anterior, and anteroposterior chest X-ray. What are the differences between the posterior anterior PA and anteroposterior AB view? What is the cardinal feature that characterize each one? As we mentioned, on PA is routine test, the chest X-ray done routinely as PA. يعني any patient sent for chest X-ray, this chest X-ray should be done in PA unless there is a contraindication or there is a problem. For example, patient in ICU, traumatic patient with مثلا instrumentation. If there is any problem, you can do this AB. But if this chest X-ray should be done routinely on PA to avoid magnification of the heart, to avoid heaviness of the lung base. So BA is the routine chest, is the standard or routine chest X-ray projection or view. Also BA, in BA there is no magnification of the heart. The size of the heart on the film is somewhat equal to the size of the normal heart in the person or the patient. But in AP view, the heart shadow appear enlarged. يعني the heart, there is an increase of the heart shadow in AB. لذلك إذا عملنا chest X-ray AP, there is increase of heart shadow or heart opacity, we are not confident is this heart shadow increase due to the technique or due to the pathology. So chest X-ray should be done in PA. طبعا this is the role of the technologist. انت كفيزيشن او انتم كفيزيشن بتكتبوا chest X-ray PA، واصلا المفروض يعملها PA we should write on the film this is chest X-ray done on PA. Also BA chest X-ray characterized by clear lung field. Why? Because the base of the lung appear clear, no haziness of the base of the lung. But on AB, the base of the lung may be hazy due to underinflation of this lung. And these are the other difference between the PA and AB chest X-ray. The next one is very important. Scapulae. The scapulae are seen in the field of the lung on AB. If you go back, this is the routine chest X-ray. The patient should put his hand like this and abduct the hand. So the scapula are displaced from the lung field. But in PA, the hand put on the size of the chest, so the scapula may cover the area of the lung. Yani this is the most important difference between the AB and BA. يعني the دون أعطانا chest X-ray, usually you have to look to the scapula. If the scapula are seen in the lung field, especially the medial borders, this is most likely AB film. And if the lung is spared or displaced peripherally, this is the most likely BA film. So BA is easy to read because the lung field is clear, no heaviness of the pairs, the scapula are not in the lung of the field, but there is a difficulty in interpretation of the AB film due to presence of the scapula in the field of the lung. The scapula covering the field of the lung, and the base of the lung may appear hazy, and also the heart is magnified. So this is chest X-ray. If you ask about the modality, this is plain X-ray. This is AB and this is BA. If you compare, first the cardiac shadow. The cardiac shadow is magnified in AB. If we measure the cardiac shadow in this one and in this one, the cardiac shadow is magnified here. Although this patient has no cardiac problem, but the cardiac shadow or cardiac capacity appear enlarged. This is the first difference between BA and AB. If you look to the scapula, this is the medial end of the scapula, and this is the medial, this deal scapula, this one, the medial end اللي هو اللاين ده, this is the medial end. You can see this scapula covering most of the lung field. If there is a lesion here, it may be covered by this scapula. But in PA, the edge of the medial edge of the scapula seen in the periphery, out of the lung field. So BA is easy to be reported and easy for interpretation compared to the AB. And also you can see the diaphragm appear higher in this AB, but in this one it's seen low down. This is other feature of the difference between the AB and BA. The other is this is the clavicle. On AB, the clavicle may obscure or cover the apex of the lung. Yani also if there is any abnormality lesion in this apex, it may be covered by this clavicle. But here the apex are clearly demonstrated. So these are the differences between the AB and BA chest X-ray. طيب عندنا التكنولوجيست when we do this chest X-ray عندنا حاجة اسمها factor, كمية الأشعة, the amount of radiation that required to form this radiation. He must adjust the required amount of radiation to gain good quality X-ray. يعني لازم يكون the radiation not more or not less, should be adequate or optimum for this chest X-ray. وهو عندنا حاجة اسمها في الماشين عنده حاجة اسمها numbers بيعمل لها adjustment اللي هي amount of radiation, حاجة اسمها KV and MA اللي هي determines the quantity of the X-ray photon. يعني محتاجين لأشعة كثيرة ولا قليلة. If you have these technologies, use the amount of radiation to get good quality X-ray concerning the factor. When we say factor, we mean the amount of radiation. But this is chest X-ray with adequate penetration, with adequate factor, with adequate amount of X-ray photon, because are you are able to see the lung field clearly. This is a lung field. Both sides are equally translucent. يعني درجة السواد blackness of both of normal. But here the lung appear. Yes.
دكتور في طلاب يقولوا انه لازم تقبلهم عشان يدخلون.
Okay. This is adequate X-ray. You can see the lung field on both sides with good quality. If there is any pathology, you can detect it easily. But in this one, if you look again to the both lung field, the sides, the two sides appear very black, very loosened. And if you look in this one, you can see the lung field is opaque. Like how to know this film or this chest X-ray is of good quality or of bad quality concerning the factor. How to assess this film? You have to look to the spine behind the heart. This give you a clue. انت ما حضرت التكنيك لكن you can guess and you can determine if this chest X-ray done with good amount of radiation or not. If you look to the spine behind the heart on all these film, in this one you can see the spine and intervertebral disc. These are intervertebral disc and the spine are just visible. Intervertebral discs and vertebrae are just visible. بتشوفها مر يعني على خفيف. So this means this is adequate film. يعني this patient receive optimum amount of radiation, and so the result is very good quality chest X-ray. But in this one, this patient, if you look again to the spine, it is, you can see the spine and the intervertebral disc more than this. This indicates this patient received large amount of radiation. بيسموها over penetration. يعني over radiation. But this is over penetrated chest X-ray. Why? Because the intervertebral disc and vertebra behind the heart are clear. But the lung parenchyma is not clear. لاحظوا ان lung parenchyma there is a, مثلا اذا كان عندنا cavity دي lesion فيها air, difficult to be seen in this good bad quality X-ray. Right. In this one, if you look again to the spine and intervertebral disc, you are not able to see the vertebral or intervertebral disc. Difficult to visualize this vertebral and intervertebral disc behind the heart. This is called under penetration or under exposed film. معناتها البيشنت ده receive less amount of radiation than required. The result is this. لاحظوا انه the lung parenchyma هي برضه not clearly seen such as in this. لاحظوا انه هي شوية شنو more opaque. So when we give X-ray to check it for quality concerning the penetration, you have to look to what? To look to the spine and intervertebral disc. If it is just visible, يعني تكون على خفيف كده ظاهرة, this means this good quality chest X-ray concerning the factor, the amount of radiation. If you are not able to see this spine totally, this means this patient receive more X-ray وبيسموه less X-ray وبيسموه under penetrated chest X-ray. If you see this spine and intervertebral disc more يعني بقت مرة واضحة, this means this is a overexposed. The overexposed يكون ال lung difficult to be seen, and the underexposed also, if there is a lesion, there is a difficult to be, there can be opaque lesion, difficult to be seen, and here if there is a loosened lesion, difficult to be seen. But in the adequate or optimum film, if there is a loosened or opaque lesion, it will be clearly demonstrated. So chest X-ray should be done with good factor. طيب اتكلمنا عن expiration, inspiration. The chest X-ray routinely done on inspiration. What are the effects of the expiration on the chest X-ray? قلنا إنه the base of the lung on expiratory film is appear hazy. لاحظوا إنه this is the base. The base of the lung, a lower part of the lung in this PA is clearly demonstrated. If there is a lesion here or here in the base of the lung, in this adequate inspiratory film, this lesion may be easy to be detected. But if there is any مثلا pneumonia in this area, it is difficult to be seen because there is a haziness or blaring of the base of the lung. This is not a pathological blaring. This is due to technical errors, due to technical cause اللي هو due to expiratory film. لذلك إنه chest X-ray should be done in inspiratory film. طيب أنت ما حضرت التكنيك. You did not attend the chest X-ray. How to know this patient did not take full inspiration? You have to count the ribs. This is a posterior rib. This is the first one, second, third, fourth, fifth, sixth, seventh, eighth, ninth. The diaphragm at the level of the 9 or 10 posterior rib in this one. But in this one, this is the first posterior rib, and this is the second one, and this is the third, fourth, fifth, sixth, تقريبا at the level of the sixth posterior rib. But this patient did not take a deep breath, did not يعني شنو taking a deep breathing. لذلك the lung is not inflated by the air. عرفنا كيف؟ by the level of the diaphragm. So on good inspiratory film, this is a good inspiratory film, the right hemidiaphragm should be at the level of the anterior end of the sixth rib, anterior rib of the sixth rib, or at the level of posterior 8 ribs. Be in the good quality inspiratory film. لكن if the diaphragm is higher, يعني بقى at the level of the 6 or 5, معناته this patient did not take a deep breath. فإذا in good inspiratory film, the dome of the diaphragm of the right hemidiaphragm at the level of anterior end of the sixth rib, and the right hemidiaphragm is normally, لاحظوا انه right hemidiaphragm normally higher than the left one by about 2.5 centimeter. يعني إذا تعرف normally the right hemidiaphragm is higher than the left one. This is normal. يعني لكن إذا كانت the left hemidiaphragm لقيته في chest X-ray higher than the right, this means there is abnormality. But the right hemidiaphragm normally located by about 2.5 centimeter higher than the left one. So from this slide, you have to know the chest X-ray should be done on inspiration to prevent or to avoid haziness of the lung, like this, to avoid haziness of the lung, and you have to know how to assess the inspiratory film from the expiratory by counting the rib. If the right hemidiaphragm at the level of the anterior 6 rib or more, this is 6 to 8. This means this is a good inspiratory film. But if it is higher, this is patient does not taking a deep breathing. And also you have to know the right hemidiaphragm is higher than the left one by 2.5. How to assess the patient rotation. يعني the patient should be straight on anterior to the tube or posterior to the tube, not tilting to one side, to the left or right side. يعني ذلك إن the patient should be stand straight, not tilting to one side. When there is a tilting of the patient, this may affect the quality of chest X-ray. How to assess the rotation of the patient. انت طبعا برضو did not attend the technique, but still you can know this patient is not standing straight when performing this chest X-ray. تعرف كيف? By looking to the medial end of the clavicle. This is the medial end of the clavicle, left one, and this is the medial end of the clavicle. You have to look to to measure or to assess the distance between the medial end of the clavicle from the midline, from the spinous process or trachea, and the medial end from the of the other side from the spinous process. If they are equal in distance, this means this patient not rotated, يعني كان straight. لكن if the distance is more on one side, this means this patient is rotated during the exam. So the sign of centering of the patient, non-rotated patient, is equidistance of the medial ends of both clavicle from the midline اللي هي from the spinous process. ممكن اللي هي دي this is the spinous process. You can measure the spinous distance between the spinal process to the right and the same spinous process to the level. If they are equal, this means this patient is centered, not rotated. اللي هي this explaining this magnified film. This is spinous process. You can measure the distance from the medial end of the left clavicle from the spinous process and the medial end of the right clavicle from the same spinous process. If are equally, this means this patient is centered, not rotated to one side. Because if the patient is rotated, this may affect the quality. One side may be more plaque than the other. But this patient is rotated. Why? Because this is the midline, this is the spinous process. If we measure the medial end of the clavicle, right clavicle from the spinous process, here is less than on the left side. The distance here is more, and the distance here is less. This means this patient is rotated during the exam, and this affects the blackness or translucency of the lung. Normally, the chest X-ray should be equally in translucency or blackness. The lung containing air, and the lung appear loosened due to this air. لكن مع الروتيشن ده, if there is a rotation, one side appear more plaque. But the more closer part to the film بيكون شنو more plaque than the other one. فإذا نعرف when there is a rotation, this may affect. يعني احنا بعدك هنعرف هيكون عندنا مشكلة. Is this increase blackness بيسموها translucency of one side, is it a pathological or is it a technical? لذلك you have to do this chest X-ray in well-centered patient to avoid this increased blackness or translucency of one side. طيب احنا الآن في respiratory system عندنا structure معينة you have to know them. أول قلنا عندنا two lungs on both sides which are translucency, symmetrical translucency, because they containing air. لذلك لابد يكون equally or symmetrically translucent both lung. And this is a trachea on the center. Normally should be on the center or slightly deviated to the right. And the trachea is bifurcated into right and left main bronchus as this point, which is called the carina, the point at which the trachea is bifurcated or deviated into right and left main bronchus. And this is a right hemidiaphragm. This is this line, the right hemidiaphragm, and this is the left hemidiaphragm. The left hemidiaphragm. This is the left costophrenic angle. This is a sharp angle, left costophrenic angle, and this is the right costophrenic angle. This is the scapula اللي اتكلمنا عنها إنها should be on the periphery on the BA. لكن إذا كانت AB, the scapula is usually seen on the lung field. But this is the normal appearance of the respiratory structure on the plain X-ray اللي هي معروف إنها هي trachea وال right and left main bronchus which are divided into secondary and tertiary bronchi and the alveoli which are filled with air. This is the anatomy of the lung. طيب نعرف normal chest X-ray. What are the normal structure that or what is the characteristic feature of normal chest X-ray? أول شيء عندنا the lung. On chest X-ray شفنا lung should be equally translucency. What are the structures that may be seen within this lung? عندنا structure normally seen within this lung. What are they? أول شيء blood vessels. You can see the blood vessels within the lung field. هي lucent لكن blood vessels بتكون opaque. Here, these are the blood vessels. الخطوط البيضاء these are blood vessels. This is normally seen in normal. يعني إذا شلنا الشادو دي اللي هو opacity دي this is a normal lung. This is a normal opacity of the blood vessels. So the first structure may be seen normally on the chest X-ray is blood vessels. The second one is the interlobar fissures, such as horizontal and oblique fissure, and sometimes wall of the larger bronchi. These only يعني any other structure apart from this, if it's seen on the chest X-ray, this is considered abnormal. لذلك لازم نعرف what are the structures that normally seen on brain chest X-ray may be seen normally. إذا لقينا blood vessel normally should be seen or interlobar fissure or wall of the cervical line. طيب نحن قلنا the interlobar fissure may be seen on the lung chest X-ray or the chest X-ray. What are the fissures that may be seen in the chest X-ray? احنا عارفين عندنا horizontal fissure on the right lung and oblique fissure on the left one and right one. يعني the horizontal fissure is only seen or visible in the right lung in frontal chest X-ray, frontal projection. يعني ده طبعا هي sometime on the frontal chest X-ray this horizontal fissure may not be seen, but if it is visible it is usually seen in frontal projection. لما نقول frontal this means PA or AB, not lateral. But this horizontal fissure usually seen in frontal. يعني اللي هي either AP or PA film. How this horizontal fissure appear? This horizontal fissure, if visible, is seen as the thin line that running from the right hilum to the sixth rib of the. This is the horizontal fissure is seen as a horizontal line, not vertical line. It is seen as horizontal line running from the right hilum to the axilla at the level of the sixth rib. But this is a normal appearance and position of the horizontal fissure. لازم تعرفوا the feature and the feature of the horizontal or بيسموه minor or horizontal fissure. نحن طبعا عارفين ان the left lung there is no horizontal fissure, there is no minor fissure. The horizontal fissure located on the right lung only. But oblique fissure can be اللي هي موجود وين in the left and either the and also the left lung. This oblique fissure, if it's seen, it's usually seen on lateral view. ما بنشوفه في الفرونتال زي اللي هي الفرونتال fissure. This oblique fissure, if it's visible, it is usually seen on lateral view. دي بنسميها interlobar fissure. عندنا another anatomic variant lobar fissure seen in 1% of people, which is called a Kestra fissure, may be seen in frontal view, which is called azygous lobe fissure. فإذا عندنا دي بنشوفه في بنلقاه in 1% of people. اسمه إيش؟ azygous lobe fissure. This could be seen in 1% أو يكون موجود in 1% of patient. If it's visible, it's seen also in frontal view. زيه إيش؟ زي horizontal fissure. طيب عرفنا الستراكشر ذات normally seen as the appearance of the horizontal and oblique fissure and on which view they may be seen and the anatomical variant اللي هو azygous lobe fissure that also may be seen on frontal view. The trachea normally lies midway or slightly deviated to the right. هي طبعا containing air لذلك هنشوفها هي translucent tubular structure on the midway and it may be slightly deviated to the right. This is the normal position of the trachea. The nerve of the trachea normally midway or slightly deviated to the right from the midpoint. And normally he is seen between the medial end of the clavicle. طبعا هي containing air لذلك بنشوفها هي ايش شنو as a column or tubular structure containing air اللي هي lucency within this tube. The diaphragm, the upper surface of the diaphragm should be clearly visible from the costophrenic to the other, except where the heart and mediastinum are in contact with the diaphragm. If you look here, this is the diaphragm, and this is also the right hemidiaphragm, and this is the left. If you go from the left costophrenic and trace the diaphragm, you can trace it and you can see the diaphragm, but in this area you are not able to see the diaphragm. So the diaphragm should be seen from the left costophrenic angle to the right costophrenic angle, except in this region, except in the area in contact with the heart and mediastinum. المنطقة دي the diaphragm is not seen. Why? Because the diaphragm is the muscular structure and the density of the muscle and the muscle of the heart are similar. وهنا the lung is loosened لذلك بنقدر you can see the diaphragm, but here difficult because the density are similar. احنا ما بنقدر نشوف two densities of similar two structure with similar density. لذلك the diaphragm is not seen in this area. If it's seen, this means there is abnormality. On good respiratory film, again, the dome of the right hand diaphragm should be at the level of the anterior end of the sixth rib, and the right hand diaphragm should be up to دي اللي اتكلمنا عنها on the good quality X-ray in respiratory film. إذا نعرف why the diaphragm does not be clearly seen on the area in contact with heart and mediastinum. طيب again to fix your knowledge on the chest X-ray, this is chest X-ray, plain X-ray or plain chest X-ray or plain radiograph. لاحظوا إنه the both sides are equally translucent. ما في one side more black than the other. الخطوط دي these all are blood vessels. These are blood vessels normally seen. These branching, line and tapering هي بتكون كثيرة in the center. حصل لها شنو tapering on the periphery. لاحظوا إن هي بتقل كل ما نمشي للأطراف. This is شنو blood vessel. But this is the right hemidiaphragm should be seen clearly except on the area in contact with heart and mediastinum, trachea in the center. لاحظوا إن في air هنا دي trachea, and then it divided into right and left main bronchus. The right hemidiaphragm is higher than the left one by about 2.5 centimeters. This is a right costophrenic angle. الانجل دي مهمة لأنه if it is obliterated بقت ما angle كده دي indicate abnormality. This is right and left costophrenic angle. عرفنا انه عندنا الفيشر مهم جدا نعرف انه the right lung عندنا two fissure horizontal and oblique fissure. So we have 3 lobes: upper lobe, middle lobe, and lower lobe. And the left one there is only upper and lower lobe and only one oblique fissure. هنعرف الكلام ده on X-ray, but this is lateral X-ray. دايرين نعرف where is the position of the slope on X-ray. دي مهمة جدا إنه نعرف the position of the different lobes on lateral chest X-ray. طبعا this is the imaginary line اللي هي at the level of the oblique fissure, and this imaginary line at the level of the minor fissure on this oblique chest, on this lateral chest X-ray. On the right lung, the right lower lobe is localized or situated behind or posterior to the oblique fissure. يعني إذا عندنا if there is any lesion in this area اللي هي posterior to this oblique fissure, this is posterior and this is anterior. لاحظوا إنه this is anterior, this is sternum, and this is the spine. So this is oblique fissure. Posterior to oblique fissure is the right lung lobe, right lower lobe. يعني if there is any lesion, يعني إذا عندنا opacity or مثلا tumor in this area, this means this is the right lower lobe. If it is here or here, يعني المهم كانت posterior to this oblique fissure, this means this right lower lobe lesion. If it is anterior to oblique fissure and superior to the horizontal fissure, this lesion is in upper lobe, is an upper lobe lesion localized or located anterior to oblique fissure and superior to the minor fissure. لاحظوا لها هنا دي this is the area of right upper lobe. ليش؟ Because it is anterior to the oblique fissure and superior to the minor fissure. يعني إذا عندنا opacity or lesion or tumor or any مثلا foreign body in this area, this means this lesion is in the right middle upper lobe. Right middle lobe located inferior to the horizontal fissure and also anterior to oblique fissure. This is the area of right middle lobe. يعني إذا عندنا any lesion in this area inferior to the minor or horizontal fissure and anterior to the oblique fissure, this is the right middle lobe. طيب عندنا في ال left lung طبعا عندنا this is also oblique fissure. This is the imaginary line at the level of the oblique fissure. طبعا احنا on the left lung we have only 2 lobes. The lower lobe of the left lung located posterior, similar to the left lower lobe on the right lung. It is also posterior. This is posterior. This is the spine and this is the anterior aspect of the chest. But this is the lower lobe located posterior to this oblique fissure, and the left upper lobe is seen anterior to this oblique fissure. But this is how to localize the lobe. Again, هنكرر الكلام ده. أول this is frontal chest X-ray, and this is lateral chest X-ray. طيب من الفرونتال بتعرف انه اذا عندنا ليجن هير اور دايرين نعرف اللوب وات از ذيس لوب. اول شيء this is right lobe. ليش؟ لانه on the right side, it is not in the left. The color lobe on the right, but this is the if there is any lesion in this area, this is right lesion, right lung lesion. طيب from the left to the lateral, you can see this color region located anterior to the oblique fissure and superior to the horizontal fissure. So this is right upper lobe. This is the area of right upper lobe. If it is there, this is the right middle lobe. If it is here, this is the left right lower lobe. يعني إذا كان شفنا في الرايت أول you have to look to the right to know which side. Then for localization or to know the lobe, you have to look to the lateral. This is the position or area of the right upper. This is the right middle, and this is the right lower. So this is the color region on the right. On the lateral, the color region seen inferior to the horizontal fissure and anterior to the oblique fissure. So this is the right middle lobe. If it here, it is the right upper lobe. If it is here, it is in the right lower lobe. طيب.
دكتور.
Yes.
كيف أعرف اللاترال فيو؟ كيف أعرف إن هي رايت لانج ولا ليفت لانج؟
اوكي ان شاء الله. لذلك انا قلت لك انه اول you have to look to the frontal. انت اول بتكون عارف عندك two film. First frontal. From the frontal بتكون عارف انه الليجن on the right side. يعني مثلا عندنا tumor here. اكيد this is the right, this is the left. Always on the chest X-ray, this is the right side and this is the left. From the right side, this is the from the frontal view بتعرف انه this is the lesion on the right side. بعد ذاك بتيجي تشوف on the left on the lateral fin بتعمل you are able to localize the tumor. يعني حتعرف انها which lobe on the right. يعني انت عرفتها من الرايت من الفرونتال. Then you have to look to the lateral for localization. لانه هنا في in the frontal difficult to localize the lobe لانه هنا overlapped superimpose this lobe. لكن on the lateral you can easily discover the lesion if it is in the any lobe. فلا ذلك انه لابد انك شنو to look for the frontal view firstly to know the side, and then you have to look to the lateral film. اذا اعطوني lateral film يعني ممكن يكون في difficulty from the lateral film only, difficult to localize this lesion in the right or on the left or in the left. لأنه ممكن الليجن تكون on the right or on the left when it could be seen in this area. But difficult to localize the lesion on lateral film only or to localize the side يعني. لكن it is easy to localize the lobe if you know the site of the lesion. If it is in the right upper, right middle, or right lower. If it is not clear, inshallah, I will.
لا شكرا يعطيك العافية.
explain it inshallah. طيب. This is a frontal view and this is a lateral. If there is a lesion on this side from the frontal, here there is a lesion on this area, but still I'm not able to localize this lesion. Is it in the right upper or right lower? Because قلنا هنا superimpose. ليش؟ بليز لو لاحظتوا هنا في this diagram ممكن يكون عندنا lesion in this area وانا بعمل chest X-ray. طبعا X-ray حتمر عن طريق this part and this part. If there is a lesion here or in the area or this area, it will be appear on the same side on the chest X-ray. يعني إذا كان عندنا lesion here or here عملنا chest X-ray, this will be appear لأن هم overlap. والإكس-راي هي لما تمر بتعمل الشادو on the film ما حتعرف إنه هي مرت على الرايت or اللوب ولا الميدل لوب ولا الأبر لوب لأنه both or these tissue receive the X-ray اكس راي مرت عن كل التشو دي. if there is a lesion here ما حنعرف إنها، لذلك إنه the lateral help in localization. طيب here from this frontal there is this is the مثلا left side lobe، لكن still we are not able to know this is the right or upper، لكن this is the left, this color area on the left side. I mean, if you look to the lateral field, the color area occupy the region anterior to the oblique fissure. So this is left upper lobe, not lower lobe, because left lower lobe occupy the region posterior to the oblique fissure. The color area in this frontal is in the left side. On the lateral film, the color region occupies the region posterior to the oblique fissure or seen posterior to oblique fissure. So this is the region of the left lower lobe. Why? Because it is posterior to oblique fissure. Posterior to oblique fissure. And so you have to look for the frontal view first, then look to the lateral film. طبعا تكلمنا عن horizontal fissure that may be normally seen on the chest X-ray and it is usually seen in frontal. يعني this is frontal chest X-ray, not lateral. If you look carefully, there is a thin horizontal line or opacity running from the hilum to the axilla at the level of this 6 rib. 1, 2, 3, 4, 5, 6. But this is 6 number 6. There is a thin line. This لو دققت شوية بتشوفوا this line opaque اللي هو خط أبيض خفيف thin running from this is the hilum of the lung to the periphery to the axilla at the level of the 6 rib. But this is a horizontal fissure. نحن قلنا horizontal fissure may be normally seen on the chest X-ray on frontal view, and this is the lateral X-ray of the thorax or chest illustrates this line. This is the oblique fissure. Now قلنا oblique fissure usually seen on the lateral film, but this is oblique fissure seen on this lateral chest X-ray. طيب برضو اتكلمنا عن azygous lobe fissure اللي هو قلنا accessory fissure seen in 1% of people اللي هو بيكون عبارة عن ايش؟ بيكون عبارة عن شنو؟ thin line with convex lateral border. يعني لاحظوا إن هو convex here. But this is azygous lobe fissure. This is azygous lobe fissure. This is normal anatomical. This is an anatomical variant. It is not pathological. يعني. If يعني you have not to confuse with this line. يعني this is a normal, azygous lobe fissure. If it's seen, it is normal. It is not a pathological. It is anatomical variant. Which is called azygous lobe fissure. تعرفوه كويس ممكن بالأسبي نسألكم what is this arrow point to. This is azygous lobe fissure in this plane X-ray. طبعا احنا ناخذ فكرة عن ال other structure. احنا عرفنا اللنج والتراكية and diaphragm. Also the spine يعني the bone, the ribs, the clavicles and the scapulae. All this bone structure may be seen on the frontal chest X-ray. In addition, you can see the sternum on the lateral film. لاحظ أن sternum seen on the lateral chest X-ray, but يعني difficult seeing clearly on the frontal. This is the region of the sternum. This is the bone structure of on the chest X-ray. طيب كان تكلمنا عن إنه the both lungs should be equally translucency. يعني the degree of blackness should be symmetrically on both sides. This is the shadow of the breast. لاحظوا إنه the breast is soft tissue density اللي هو gray. طيب ف if the patient underwent mastectomy يعني إذا كان عملنا surgical removal of the breast, the site of the mastectomy, how the site of the mastectomy will be appear. This is for you. If there is a patient undergone mastectomy or if there is a history of mastectomy on the right side, نتكلم إنه إذا عندنا mastectomy on the right side, how this mastectomy affect the translucency of the lung. Anyone? If we remove this breast, how about the density on this side? If we remove this breast,
more black.
yes, more black, more lucent, more black. لأنه هي دي soft tissue. If we remove هتأثر لنا على ال density هي هتكون لنا this. إذا if there is a history of mastectomy, the site of mastectomy will appear more translucency, more black than the other one. لذلك دي بنعتبرها one of the differential diagnosis of increased translucency of one side. يعني إذا عندنا patient chest X-ray of the patient demonstrate one side is more translucent or more black than the other side, you have to look to the breast. If there is a mastectomy, this is one of the differential diagnosis. So the side of the mastectomy appear more translucent, more black. Again, this is a chest X-ray. جبناها بس عشان تعرفوا to look for the normal lung and trachea and diaphragm on the frontal and lateral film and the increased translucency of the vertebra when we go down the right and left hemidiaphragm and so on. The next technique is CT. CT or computed tomography. عارفين CT chest examination consists of contiguous section. لاحظوا مثلا هنا عندي احنا بناخذ section. This yellow lines بيسموها scout view or topogram اللي هي بتحدد لنا the level of the section. هناخذ section like this. فإذا CT cast consists of contiguous section. بناخذ section then section يعني slice. فهي بعد ذاك then we look for these different slices. Sometimes this CT may be done with contrast and sometimes will be done without contrast. If intravenous contrast medium is given to the patient, and especially when we are interested in the mediastinum or on the hilum or pulmonary vessels or for assessment of the lesion. يعني إذا بنعطي الكونتراست why for demonstration of the blood vessels or to assessment of the mediastinum in general and the hilum, and if there is a lesion for characterization of the lesion is there. فإذا دي في الحالة دي بنسميها شنو contrast enhanced CT يعني CT with contrast. But CT can be done without contrast. ممكن نعمل CT without contrast يعني ما بنعطي البيشنت contrast. دي بنسميها non enhanced CT or CT without contrast. So there are two techniques, CT with contrast and CT without contrast. Also we have two windows. عندنا two windows مهمات جدا. The first one is called lung parenchymal window and the other one is called mediastinal window. How to differentiate between the lung parenchymal window and mediastinal window? On the lung parenchymal window, the details of the lung parenchyma is clearly demonstrated. لاحظوا ان هنا بنشوف the details the blood vessels and the shadows of the blood vessels on the lung parenchyma is clearly seen in this CT axial of the chest. But in this one, the details of the lung parenchyma is not clearly seen. So this is called mediastinal window. So the difference between the mediastinal window and lung window is on mediastinal window, the lung parenchyma is not clearly demonstrated, but the vessels and other mediastinal structure are clearly demonstrated. And on lung parenchymal window, the details of the lung is clearly demonstrated, and the details of the mediastinum is less. Also, this is the mediastinal window. The details of the lung parenchyma is not clearly demonstrated, and this is the lung window. You can see the details of the lung. عندنا الثاني تكنيك اسمه high resolution CT اللي هي CT done with high resolution. يعني بتكون عندنا scene section، ناخذ very thin section for very small lesion. فدينا more details for very small lesion or for more detail of the lung parenchyma. ده بسموه شنو high resolution CT. High resolution CT is a technique done with thin section for demonstration of the more details of the lung parenchyma and small lesion. High resolution CT demonstrates pulmonary parenchymal disease and also many diseases such as bronchiectasis. ما بنعمله routinely. If there is, we are interested in the details of the lung parenchyma, مثلا عندنا small lesion or in the bronchiectasis. طيب نحن عرفنا كان in the chest X-ray the normal structure that normally seen on the chest X-ray. The same structure that normally seen on the chest X-ray are the same structure that seen on the normal CT. يعني on the lung region you can see the blood vessels. لاحظوا الخطوط البيضاء, these are blood vessels. And also you can see the fissure. Normally you can see the fissure. يعني sometimes you can see the fissure and also the wall of the bronchi. The wall of the bronchi can be seen. These are the structures that normally seen, the same structure that's seen on the chest X-ray. The indication for CT, there are many indications. We conclude them in this indication. Evaluating abnormality on chest X-ray. Sometimes we can do chest X-ray, but still the result is inconclusive. It is not clear. In this time, you can perform chest X-ray for more characterization of the lesion that's seen on chest X-ray. يعني مرات بيكون عندنا lesion لكن I'm not out. We are doubt about this lesion. Is it tumor? Is it foreign body? Is it artifact? يعني due to يعني technical causes. For this chest X-ray required, this patient required CT for more evaluation of this abnormality in chest X-ray. Investigating cause of breathlessness, for example, patient with pulmonary embolus. لأنه إذا البيشنت جاب pulmonary embolism, the investigation of choice is pulmonary angiogram. The best technique for investigation of pulmonary embolus is pulmonary angiogram, or for interstitial lung disease برضه ممكن chronic lung disease. This is the CT is mandatory to be done. For staging of the cancer, staging of the cancer is very important for management, for the plan of the management. If this patient requires chemotherapy, radiotherapy, surgical, and so forth. So before starting the treatment, you have to stage this cancer, and this CT play very important role in staging of many of the cancer. Evaluation of vascular anatomy to look for the blood vessels, especially thoracic aneurysm or thoracic aneurysm dissection. برضه thoracic aortic aneurysm dissection CT is very important, although it may be discovered by ultrasound, but CT play a very important role, and there is a strong indication for CT in this case. Also, the last one is very important, performing CT for guidance, a needle or an instrumentation for taking a biopsy or for respiration. فنحن عندنا مثلا lesion in the lung, to take a biopsy for this lung, this CT can be used for guidance, a needle for taking a biopsy, or also CT can be used for respiration of مثلا pleural effusion. مهم جدا تعرف انه CT عندها role, very important role for guidance biopsy or for aspiration مثلا in case of pleural effusion. Very important role for CT. Now we are going to demonstrate some CT. أول شيء لازم كيف تعرف إنه this is CT. من الآن تتذكروا إنه CT لأنها بتستخدم X-ray the bone. How to look to the bone. مثلا this is a sternum, this is a vertebra, this is a scapula, and these are ribs. CT, all this structure لأنه containing calcium appear very dense, bright. هنا الآن تذكروا تماما أن this is the second block. يعني to differentiate between CT and MR لأن بعض الناس بيكون عندهم difficulty in differentiation. You have to look to the bone. This is axial section of the on the chest. لاحظوا إنه البون the bone لأنه containing calcium زي الإكس-راي بيكون very dense, very bright. But this is the CT. طيب نحن بيهمنا الآن في this block the trachea is the central. This is the trachea, and this is the right lung, and this is the left lung. On this mediastinal window. ليش؟ لأنه the lung detail is not clearly seen. But this is the mediastinal window at the level of the trachea. This is the trachea, and this is the left lung, and this is the right lung. And this is the CT also, mediastinal window. ليش mediastinal? Because the details of the lung parenchyma is not clearly visible. And this section is below to this ليش؟ لأنه the trachea is starting to bifurcate into left and main bronchus. لاحظ إنه التراكية هي إيش؟ tubular structure containing air. هنا after bifurcation or dividing into right and left main bronchus, this is left lung and this is the right lung. This is CT chest or CT thorax of lung parenchymal window. ليش lung parenchyma not mediastinal؟ لاحظوا the lung, the details of the lung parenchyma is clearly visible or visualized. On this window we see the lung parenchyma clearly. ركزوا في شنو lung parenchyma is clearly visible in this. But this is called شنو lung parenchymal window. لكن دي هنا the lung parenchyma is not clearly seen. So this is the mediastinal window. The other modality is MRI, magnetic resonance imaging. Although it has a very small role in management of pulmonary or mediastinal disease, it is not frequently requested for assessment of the pulmonary or pleural mediastinal disease. MRI can be used in selected patients. For example, if the patient presented with apical tumor, Bankos tumor, apical tumor on the lung, مثلا عملنا chest X-ray, if there is a tumor in the apex, دائما بتكون difficult to be assessed by plain X-ray and also by CT. لأنه on the apex area بيكون عندنا many ribs and clavicle that affecting the quality of the CT and also the plain X-ray. But so in this time, MRI may play important role in this case. لكن here in general, MRI is not commonly or frequently done for assessment of the lung pathology. لكن MRI can be done for pregnant ladies. يعني إذا في عندنا patient ladies لأنه the CT and X-ray has a hazard for this patient. the only option is MRI. لذلك إذا سألناك مثلا عندنا pregnant lady أو ممكن أقول لك ما نقول لك pregnant نقول لك patient with amenorrhea for مثلا 2 months or 3 months. Amenorrhea معناتها this patient may be pregnant and present with مثلا suspected lung tumor. What is the appropriate imaging technique? So MRI is appropriate. Why? Because CT and plain CT and plain X-ray carries hazard for this patient. So the appropriate technique is MRI to avoid irradiation for the this intrauterine pregnancy. Again, to differentiate between MRI and CT, قلنا how to differentiate, you have to look to the bone. يعني anywhere مثلا جابوا لنا chest إذا البون موجود in the vertebra and on the scapula and on the ribs and the sternum. In this one you can look to the spine, the vertebra and the scapula is very dense, very bright. So this is CT. But in this one the vertebra are not very dense, or the ribs and even the sternum they are not very dense, are not very bright. So this is MRI. Also this one, the vertebra and the sternum and the ribs also not very dense, similar to this. And also in this one, the vertebra and the spine and the sternum and the ribs are not very dense, similar to this CT. So all these three are MRI of the thorax, and this is only the CT because the bone which is containing calcium appear very dense, very bright on this technique. The last technique تقريبا the ultrasound. The use of thoracic ultrasound is confined to process in contact with the chest wall. يعني ultrasound has the role only on the pathology that in contact with the chest wall, with the superficial lesion, and also for the مثلا for example pleural effusion or pleural mass and some selected mediastinal mass. But in general, the ultrasound is not frequently done for assessment of the lung lesion, especially the deepest one. But if the lesion is superficial and if there is a effusion, an ultrasound, good technique for any structure containing fluid. And it is a good technique for detection of pleural effusion and superficial lesion in pleura and some mediastinal tumor. The next sentence very important اللي هي إنه ultrasound is a very useful technique for guidance and needle for sampling or draining effusion or taking a biopsy. نفس الكلام اللي تكلمناه عن السي تي. لذلك انه من الان تحطهم in your mind the two techniques that use for guidance. دائما بنستخدم التراساوند او سي تي. There are two imaging techniques that usually for guidance, the needle or any other instrument for taking a biopsy or for aspiration of the fluid collection, for example. يعني إذا عندنا nucleated fluid collection, this can be drained by a tube inserted through ultrasound guidance or inserted through CT guidance. So CT and ultrasound both can be used as the guidance technique for a needle biopsy or aspiration cytology in the anywhere. Now we are concerning about the the pleural and the lung. So CT and ultrasound used for guidance the needle or any other instrument for biopsy or aspiration of the fluid. Ultrasound cannot be used to evaluate process that localize too deep in the lung. لكن زي ما اتكلمنا هي can be used for superficial lesion but cannot be used to evaluate process deep to aerated lung. ليش؟ because نحن الالتراساوند من الفيزيكال properties of the ultrasound إنه does not move on the air. الالتراساوند ما does not propagate on the air، لكن بتحب في الفلويد. الفلويد is a good propagated medium for the air، لكن for the ultrasound or for the sound. So ultrasound cannot be used for evaluate deep situated lung lesion because the lung is containing air. The ultrasound is not propagate or move through this aerated lung. This is all about this part of respiratory imaging. If you have any question, you are welcome. If you have any point that not clear for you, you are welcome. Ask and we'll answer.
الالتراساوند أندر استخداما من السي تي.
Ultrasound what?
الالتراساوند أقل استخداما من السي تي.
Yeah, all these modality بيسموها complementary technique. يعني مثلا إذا جانا patient according to the presenting clinical presentation، ومثلا البيشنت إذا كان pregnant مثلا، طبعا the best option to avoid radiation احنا ultrasound if it will help us in reaching the diagnosis. يعني الكلام ده بيعتمد على ال presenting symptom و according to the indication. يعني في some condition require ultrasound as initial investigation, and then we can run to other, and some pathologies may require chest X-ray as an initial investigation. يعني this depend on the presenting clinical feature of the patient. ما بنقدر نقول which is used commonly than the other technique. يعني this depend on the patient and the clinical presentation according to. You got me?
إيه دكتور، بس بالنسبة للأزايغوس ما فهمت كيف نحدده. ممكن تعيد النقطة؟
Azygos lobe fissure أول هو قلنا anatomical variant. If it's there هو بيكون thin line، بيكون في الابيكس، ما بيكون دائما in the apex of the lung. opaque line or هو ممكن نسميه شنو اللي هو خط أبيض opaque line usually بيكون convex laterally. يعني هو لاحظ إنه convex laterally on the apex. Anatomical variant seen in 1% of the people. الفيتشر بتاعته هو بيكون thin opaque line on the apex convex laterally. This is the azygos lobe fissure. هو هنا نفس الشيء azygos lobe fissure. opaque يعني bright. thin linear خط أبيض thin linear convex laterally. يعني ما بنلقاه convex شنو medially. usually convex laterally usually or دائما بنشوفه in the apex. يعني it does not seen in the lower lobe. Usually seen on the apex of the lung. Is it clear? Any more question? Try to ask if you have any more question. Yes. Any clear point? The position of the lobes, the technical factors affecting the quality of the chest X-ray, the rotation, the factors, exposure factor, the BA and AB, difference between BA and AB, the criteria of BA view and AB view. Yes, do you have any question? The effect of mastectomy on the chest X-ray, the position of horizontal fissure and azygous slope fissure.
دكتور
Yes.
أنا مو عندي سؤال بس عندي يعني طلب إذا ممكن ينفع دكتور لو مثلا تسوي لنا توتوريال للأوسبي إذا ممكن
You are
بحيث
welcome.
إنه لو كان
Inshallah, I will select the, I will make a file containing the all image that may be asked about in the OSPI, and inshallah we will discuss it on the time that's suitable for you. You have to decide the time that's suitable for you. I am ready to discuss this file with you.
يعطيك العافية دكتور مرة شكرا.
Okay. Yes. Do you have any more questions? If you have no more questions, thank you for attendance. Assalamu alaikum.